Hello, my name is Elisa Agostinetto. I'm a medical oncologist and research fellow at Institut Jules Bordet in Brussels, Belgium. And we are here in Chicago at ASCO 2024. And we just had the chance to listen to the session on the rapid oral abstract on local, regional, and adjuvant breast cancer. So I will just give you an overview of a selection of 5 abstracts that were presented in this session. So the first abstract was about the PCR results observed in the cohort of patients treated with the datopotamab deruxtecan in the I-SPY 2.2 trial. In this study, datopotamab deruxtecan was active in monotherapy with approximately 30% of patients going to surgery after 4 cycles of datopotamab and avoiding traditional chemotherapy, but this was not enough to meet the pre-specified threshold for graduation to a phase 3 trial. The second abstract is a sub-analysis of the FLEX study aimed to evaluate the association between MAMA print index and clinical outcomes of patients treated with chemotherapy with or without anthracyclines. So in this study, the authors analyzed all patients from the FLEX trial who had estrogen receptor positive, HER2 negative early breast cancer, a MAMA print high risk, and who received adjuvant chemotherapy. Then they divided the patients into 2 groups, the group high 1 and the group high 2, based on the different ranges of the MAMA print index. And what they observed is that for patients in the group high 1, there was a similar relapse-free survival between patients treated with or without the anthracycline, while for patients in the group high 2, those who were treated with anthracycline had a significant better relapse-free survival compared to those who did not receive anthracyclines. So these results suggest that the high 2 group derive a greater benefit from anthracycline compared to tumors in the high 1 group. Of course, these results required validation and confirmation. The third abstract is a sub-analysis of the NATALY trial, focusing on node-negative tumors. NATALY was a randomized phase 3 trial that tested the role of adjuvant ribociclib for high-risk estrogen receptor positive HER2 negative early breast cancer. So in this study, the authors presented the data from approximately 600 node-negative tumors and observed that also in this cohort, there was a consistent benefit from the addition of ribociclib to endocrine therapy. So these results support the benefit of adding ribociclib to endocrine therapy in all high-risk estrogen receptor positive HER2 negative early breast cancer, including those with node-negative disease. The fourth abstract is another interesting analysis that addresses the question, do ER-low tumors derive benefit from adjuvant endocrine therapy? So this is an analysis of more than 10,000 cases of ER-low tumors that show that the omission of endocrine therapy in this cohort was associated with worse overall survival. And these results suggest that endocrine therapy should be recommended in ER-low tumors and considered as a standard of care. So this study has very interesting results, but caution is needed in the interpretation due to the study design. The last abstract is a sub-analysis of the CBOMA-GECAM study, and it's a study that addresses the question, how can we identify patients with triple-negative breast cancer who derive a benefit from adjuvant capecitabine. So in this work, the authors explored a biomarker that is the immunohistochemistry expression of FOXC1 that help discriminate basal and non-basal subtypes. In this analysis, they showed that the non-basal subtypes defined by FOXC1 expression was associated with benefit from adjuvant capecitabine.